240 doctors, traded like assets between two corporate health systems, and nobody asked you. If your physician used to work at CareMount Medical, the name on the door is about to change again. This is the Westchester Brief. I'm Jim. Let's get into it. Northwell Health is acquiring roughly 240 physicians from Optum, the United Health Group subsidiary that absorbed what was once CareMount Medical. Sources inside the practice have confirmed the deal, though neither Northwell nor Optum has made a public announcement. The acquisition centers on surgical specialties, urology, orthopedics, and general surgery. To understand why this matters, you need to know the history. CareMount Medical started as Mount Kisco Medical Group in 1946. Over 8 decades, it grew into one of the largest independent multi-specialty practices in the state. 264 physicians were shareholder owners. They ran their own show. That changed on December 4th, 2020. Every one of those physicians signed employment contracts with Optum, selling their ownership stakes and converting from independent practitioners to corporate employees. Optum promised scale, resources, and stability. What followed, according to physician sources, was a different story. Primary care physicians described a system under strain, wait times increased, administrative burdens grew. Physicians reported feeling disconnected from decision-making. One former CareMount doctor told the Examiner News that primary care was, in their words, falling apart. Emergency room visits at Northern Westchester Hospital surged, and local doctors pointed to Optum access problems as a contributing factor. When patients cannot get timely appointments with their primary care physician, they go to the emergency room instead. That is not a theory. That is what was happening. Now Northwell is stepping in. The health system merged with Nuvance Health in May of 2025, creating a network of 28 hospitals and more than 14,500 providers across New York and Connecticut. Adding 240 Optum physicians expands Northwell's footprint deeper into Westchester and the Mid-Hudson Valley. For patients, this is the third identity change in 6 years. Mount Kisco Medical Group became CareMount. CareMount became Optum. Optum is now becoming Northwell. Each transition brought new billing systems, new portals, new referral networks, and new uncertainty about whether your doctor would stay. The bigger question is structural. Healthcare in Westchester is consolidating fast. Independent practices are disappearing. The county's medical landscape is increasingly controlled by 2 or 3 large systems. That may bring efficiencies. It may bring better technology and broader access. But it also means fewer choices and less local control over how care is delivered. There is also the question of what happens to primary care. The Northwell deal reportedly focuses on surgical specialties. That means the internists and family medicine doctors who stayed with Optum may remain in limbo. If primary care continues to deteriorate under Optum while the surgical side moves to Northwell, patients could end up navigating 2 different corporate systems for their basic medical needs. No timeline has been announced for the transition. Neither Northwell nor Optum has issued a public statement. But inside the practices, staff are already talking, and patients deserve to know what is coming. If you have a physician in the former CareMount network, it is worth asking at your next appointment what changes are ahead. The people making these decisions are not in Westchester. Your doctor may not know much more than you do. Here is what else is happening across Westchester this week. Yaranush, the Armenian and Greek specialty market in Westchester, closed its doors on March 15th after 38 years in business. The shop was a cultural landmark for the county's ethnic food community. Its closure follows a pattern of legacy independent retailers disappearing as lease economics and consumer habits shift. Chef Michael Psilakis is preparing to open Klēma in Larchmont this spring. Psilakis built his reputation at Kefi and MP Taverna in New York City. The restaurant will bring chef-driven Greek dining to the village and signals continued culinary ambition in the 914. Westchester County launched Westchester Explained, a new podcast series hosted by Communications Director Catherine Chiaffi. The show is designed to break down county policies and programs for residents. It is the first time the county government has launched its own direct-to-audience media channel. That is the Westchester Brief for Monday, March 23rd. If you're not subscribed to the newsletter, head to WeLiveHereWestchester.com. You will get this in your inbox every morning.